expanded program on immunization. My colleagues from the Health Promotion Directorate, other colleagues from the same program, expanded program on immunization, media colleagues. Welcome once again to yet another media briefing to orient you guys about the importance of this very important meeting, which is the round 2 polio campaign. Of course, you would definitely understand with us that during the round 1, we took you through a very, very long and lengthy discussion as to how you should prepare yourselves and get the right information in the right institution to disseminate it to the general public. And here we are to just embark into the second round. Luckily for us, this is not going to be that much lengthy or that marathon, as we've already gone through the first round and we saw how much you guys were able to really get this information and disseminate it to the general public for their consumption, and to pay heed to know that this campaign is not only for the Gambians but those resident in the Gambia, and to ensure that our interest is to make sure that every child is protected, 0 to 5 years. And in this case, we believe you're going to repeatedly do the same thing by ensuring that people get the information at their doorsteps. Without any much ado, I know that you are two busy people, and you are needed in other institutions for coverages as well. So for that reason, I'll just keep it short and then call on the program manager, expanded program on immunization, to just give a few remarks and to welcome you. Then we go into the procession proper. Thank you very much.
Okay. Can help spread the gospel for us by informing the general population that we are preparing for another round of the polio campaign to prevent our children from getting the polio disease. First of all, I would like to thank all of you, media, because the fourth estate. We want to take this opportunity to extend our gratitude, of course, on behalf of the Minister of Health, to UNICEF, WHO. These are the main funders of the activity. There is this Global Polio Eradication Initiative. That is another body set up purposely to fight polio. Through their coordinator, we want to extend our heartfelt gratitude to all of you. The chiefs also of the country are very, very helpful. If I mention that, I would want to make specific reference to the chief of Upper Badigo, who was outstanding in ensuring that all those who are not very much clear and they wanted to refuse their children from taking the vaccine, this chief took it upon himself to move with the teams to ensure that everybody in his chieftaincy definitely receive this vaccine. So we want to take this opportunity to give him special thanks, and all chiefs, the chairman of the various regions, Minister of Education, who has been very key partner, because we are dealing with children, and most of these children are found at the schools. And then they have tried very well through their regional directors as well as cluster monitors. They've really helped us to make sure that we get access to the children. I want to make specific mention of the Amana also, who are also very, very helpful, because we are fighting a disease. We cannot eradicate the disease if we are leaving people who are not vaccinated. And this is because some parents are not clear. This is the same polio vaccine that we normally get at the health facilities. So we got this one because it's a specific type of virus. If we allow it to spread, many children will be paralyzed in this country. Many children will die, and it will not stop there. It will even affect men. That's what happened to some of these vaccine-preventable diseases. If you allow them to come back and hold a grip on your nation, children are affected. It will go for the elderly, you and me. We will be paralyzed and we will die. So this is why anytime you have this campaign, always understand that because the life and health of millions of people are at stake. That is why the global partners will always get up to make sure that these things don't happen anywhere in the world. Parents are very good in this country, especially the female folk. They need to be commended. They always want to make sure that their children are vaccinated. Every month, they go to the clinic to get to make sure that all children are vaccinated from all these diseases. In the Gambia, we are preventing against 13 diseases. That's why you see all these women going to these health facilities every month. It's not because these children are sick, because we want to protect them from these diseases. So we have done this first round. We are preparing for the second round. And then we want to have a better coverage than the previous one. We know we have certain few issues, and definitely we have done very much to make sure that we are able to ameliorate or even prevent some of them at all. We realized that the last time we have been doing campaign in this country, major campaigns, frequent one were around 2014. So from 2014 to now, we have seen a lot of development. So many growth centers came up, in the Kanifing, in the Combo North, in the Combo South. So as a result, we realized that we need to boost the number of teams, and that we have done. Our partners have come to make sure that they are able to definitely increase their funding so that we can have more teams to cover these areas. So I know we have transport problem also. So that even that area also, WHO has come up to support certain regions. So it's all to say you how important the activity is to the global morbidity and mortality. That's the bottom line. We just want people, we just want people to be healthy, our children. They are vulnerable. We have no vaccination campaign for adults. Of course, that is in the pipeline. Adults will be having their own vaccination program, like the HPV, cancer, that prevents cancer among women. It's the leading cause of cancer among women, as is leading killer of women in this country. So there is now a vaccine for the girl child from 9 years upwards. So that goes to show us that globally we are trying to have a very tight grip on disease prevention. All what is important is for the population to understand. Let them not listen to those who are idle people who are going to talk to them about try to dissuade them from taking up these clinics, these vaccinations, as we have seen in the case of COVID-19. In fact, it's because of COVID-19 that we are having these problems now. Gambia, our last polio case was in 1986. Confirmed polio case, lab confirmed polio case. That was paralyzing the children here. It was our major outbreak in 1980. Since then, because of these women are going to the clinics every month, children are being vaccinated, they are protected. We are not having this. We are not having it. But because when COVID came, people fear going to the clinics. There were some rumors, and people were listening to them, unfortunately. Wherever you have a lot of unvaccinated children, know that we'll have one of these diseases will come. Either polio, either measles, either yellow fever, either diphtheria, either pertussis, either tetanus. One of them will come. In fact, in some cases, a lot of them will come, and so many children will die. So to prevent that, the only way, surest way to make sure that we protect our population, our nation, as a small country, is to ensure that we go and take these children to this polio campaign, and also the routine vaccination, monthly clinic attendance. That's the most important thing. So we just want to take this opportunity to thank you for being there for us, because you are a key partner. If we sit here, we talk, we don't have you people try to spread the information, to the people. We cannot. So all these millions of dollars WHO, UNICEF are spending on government will be futile. So that's why the media is a very important aspect of healthcare delivery system. So I want to take this opportunity once again to thank all of you, with your media houses and your chief executives, for allowing you to be here this early morning, so that whatever is going to be presented here today on this second round of the polio, which is starting 12th tomorrow to the 15th, you help us to spread, because some people are always with skeptical mind. unless they hear it from the radio. Some will say, I heard it from the health workers. Some will say, I heard it from my friends. But you people can do the work. Within a minute, you can cover the whole country for us. So that is why you are very, very key, and we definitely appreciate your coming here to make sure that at least whatever is going to be delivered here, you take it to the last person in this country. So with those few remarks, I beg to resume my seat. Thank you.
And messages to the media. I believe we've all heard it that you guys are the shortest cut to reach out to the bigger population within a nick of a time. So, which means without you, information dissemination will still be hanging and still be an issue. Aside social media, of course, we know that nowadays social media is taking toll of any form of media outlet, but notwithstanding, without you also, information dissemination will still be hanging. So he made mention of few key things which are still very, very important, which has to do with the chiefs. Of course, we experienced some handful of refusals across the country, but thanks to the few chiefs that were, volunteering to come outright to ensure that these children or these families that were refusing for one reason or the other were also coming out to see that they avail their children for vaccination. And he gave a special thanks to the Minister of Education after having, got letters written by our permanent secretary to them, and also Amana. They also tried very hard to ensure that children that are found in their schools, participated in the campaign. So also um, the funders who supported this campaign to see that it becomes a reality. No child was left behind. Of course, we had some hitches here and there in seeing that we get every child, but still the coverage was still very good. So we hope and believe that this campaign with the second round with support of WHO and UNICEF coming all out to see that all the logistics are available, all the ground is prepared to make sure that people are vaccinated. See, this is the way forward, and we definitely believe that together we can achieve the desired target that we intend for the second round, as opposed in the second round, in the first round. So, as you can see, I don't know if mine is set. We wouldn't want to preempt, but the messages will be as simple as to know that, as you can see behind me, and I believe most of you have zoomed it enough, that the first round was the 12th to the 15th of November, just a month after we come into, jump into the second round, which is the 12th to the 15th of December. And of course, it will be um, one dose of polio drops together with the vitamin A, dose of 6 months and 18 months. So here it is for us to pick this information, get it out to the public, and we make sure that we get people out from their nooks and crannies to just make sure that they participate fully in this important campaign. So on that note, thank you very much, Basida. And thank you all for being here, but to also allow Bayang Jom to take you through this short presentation to show you what your roles are as far as media is concerned, and what is it that is expected of you as after leaving these four corners, how you should relay this information, and how do you ensure you support us in the fight that we face with, joining the other people that were here. Like yesterday, we had the Christian Council, we did those of the Muslim Council and other, organizations that we feel are important in this dissemination of this polio campaign. So we believe that you also have a role to play. So on that note, I'll just keep it shorter to allow Brian to take you through. So once again, welcome on this important media briefing, and handing over to you, Brian. Thank you very much.
Environmental sample, and this time the virus was isolated in an environmental sample that was collected from the Banjul point. Still on general information on polio, it's currently an outbreak and needs to be contained. and otherwise it can infect and paralyze more children and spread to neighboring. And before it even goes to the neighboring countries, it goes from person to person, despite your age. And when it comes to vaccination, it's the most cost-effective public health intervention at all times. So it is very important for our kids, especially those under 5, to be vaccinated. The polio virus spread because there are under-immunized or unimmunized children in the country. So here what we meant is under-immunized are those children that started immunization services at some point really had dropped. The unimmunized are those that are not at all immunized. So the virus can only be seen within this population, so meaning our population is susceptible. So it is important for children on monthly basis to attend routine immunization, despite we are having the campaign, but probably it's just one of, but we had also our routine immunization that under 5s are attending every month, and every parent should endeavor to make sure their children are being vaccinated on monthly basis. And the polio virus has a reproductive number of 200. So here meaning if one child is infected, he has the capacity of infecting other 200 children within a short period of time. So you can see how infectious the virus is. And immunizing children with polio offers the safest, effective method to protect children under 5. So of course, vaccination at all time is the most public health cost-effective intervention we can ever practice. Still under general information on polio, children need to receive polio vaccination during every campaign. Irrespective of the last campaign, when this round 2 comes, they need to be vaccinated. And for those that we really have, despite the fact that the last round was a success, we had 90%, but we are aiming to have 99% of children in the Gambia being reached and vaccinated with the polio vaccine. There are still some misinformation and also some challenges that we had during the vaccination. And refusals following was concern regarding the quality of vaccines. Be rest assured, the vaccines are very safe, they are effective, and they save lives. And also cut the transmission of the polio virus. And on other vaccine, whether the polio or any other vaccine like the EPI program manager said, we had about 13 vaccines that we are giving currently in the Gambia. They must have been tested on several occasions to make sure they are really fit for the purpose. So be less assured that the vaccines honestly are safe at all times, and they're also meant to be used for the purpose. Multiple campaign rounds, like you go there, like last month you were here, this round you are here. And also there are also other health interventions that we do. The other day you were here, when obviously we had different health interventions to give. But despite the fact, whether it's been the vaccination or it's been drugs that we are giving, all we aim is to have a healthy population, especially the children under 5, who are the most vulnerable when it comes to disease and other infections. Incomplete information of the vaccination campaign. Here what we meant is at times somebody would just take the most useful information and cut it out and replace it with something that will honestly give you another thought. So these are things that we also have to stop. And in any way that we come across any information that is not very clear to us, it is important to go to the closest health facilities. We have brothers that are health workers. We have sisters that are health workers. We have uncles, fathers, mothers that are health workers. We always can go to them and clear our doubts. And also inaccurate information about the campaign, because we have anti-vaxxers everywhere. They can come with anything to say this is caused by the polio virus. Polio or any other vaccine had never caused anything that is harmful to anybody. And besides, vaccination is a lifetime course. COVID was here, it wasn't only for the children. And other vaccines too will be here, it will not be for the children. So it is very essential for a lifetime course. We are no longer only concentrating on children under 5, but people at any age. Key messages to know about the polio virus or the polio campaign. Vaccination is free of charge across the country, whether with the polio campaign or the routine vaccines that we are giving. Vaccination in the Gambia had always been free of charge. The teams in this polio campaign will be moving from house to house. We will go to markets, we will go to garages, we will go to ferry crossing points, we will go to schools, and teams too would be make sure they are deployed to places that are very far to reach or hard to reach, just to make sure children are reached wide and far. And the poliovirus vaccine that we are giving is the most stable type of vaccine ever that we would give. It will have no or very less side effects. It is manufactured also according to international standards. And all the vaccines that have been brought to the country have been WHO pre-qualified. So this alone is enough for us as media personnel to really counter any rumor that we must have had out there during the campaign or even after the campaign on other vaccines that we are giving. It has been approved by WHO. So like I said, it must be pre-qualified by WHO. And also when it comes to the country, the Medicine Control Agency would also do its role before the vaccines are given to our targeted children who are those under 5. The management and safety of the polio vaccine is closely monitored by UNICEF. And of course, they are the procurers of the vaccines in the country. And already millions of doses over the past years had saved millions of lives of children across the world. So polio has the unique ability to stop person-to-person transmission. So it is important to get our children vaccinated. The polio is safe even for newborn. Even as the campaign starts tomorrow, and there is a baby that is being born, that baby is eligible to be vaccinated. And all children from 0 as of day 1 to 5 years are the target for the campaign and should be vaccinated. This time we will not be having the vitamin A supplementation. Last round we did, and the main purpose was to give it to children under 5 just to prevent night blindness. So that's the essence of giving the vitamin A to children. But despite we're not giving it this round in the campaign, it's still available in our public health facilities across the country, and all children under 5, once you've visited on 6 monthly basis, you'll be given the vitamins depending on your age. So today, the most important thing is why we are here. And let's look at the role of the media personnel who are being represented here. And like my program manager said, we will want this information to be disseminated wide and far across the country. So as everywhere you go in the country, we have children that we are targeting to vaccinate. The ensure messages are disseminated, of course. We had our various platforms, our family, the work, anywhere that we think this would be of importance for us to disseminate. Please, let's try and do that. And also advocate through your media platform. And of course, this gathering here today will not be a better one than also when we go out, let's not forget and let it not only stop in this hall here today, but make sure we ensure the general public got the information of tomorrow, the 12th, we're going to start and will end by the 15th of December. And all under 5s are eligible to be vaccinated. And also contribute to the management and identify rumors, refusals during the campaign. I'm sorry, with the key messages that I've given here, even though probably you are not technical when it comes to vaccines, but at least you had an idea of what we are intending to have, and probably you can change somebody's mind to be vaccinated. Regards to the upcoming countries campaign rather, we also have, if you have to gather any information or share any information that we are unable to have here today, any RH, the Regional Health Directorate, the health facilities, any place that you think is a public health facility, please go and gather more information from there. That would be factual and also be useful for you to help in disseminating for people to really come out to be vaccinated. Come tomorrow to Sunday, the 15th of this month. And we also want you to reassure caregivers, parents. I'm sure some of us here are parents. Some of us are caregivers. Some of us have sisters or other relatives that have children under 5 that are obviously our target, that the vaccines are, of course, very safe and they are very effective. So children should be brought forward to be vaccinated. In the case that no vaccination team really visited your households, please, you can rush to the closest health facility to get your children vaccinated. As always, often there are teams stationed to have the few children that will be visiting the health facility. Or call, Gano. Or call the 1025 for any clarification. It's a toll-free call number. The critical information here about the campaign. Of course, last month, the 12th to the 15th was the first round. And here we're aiming to have it tomorrow, the 12th, of course, and to the 15th of December. For the second round, the strategy is house to house. But like I said, we are not only stopping at house to house, but we are going to visit every public place, including the garages, the markets, the ferry crossing points, the border points, the schools, anywhere that we think children would be available. Obviously, there would be teams to give the vaccine to children that are eligible. And we are targeting children from 0, even those babies that are born today. Tomorrow, if the team comes, they are eligible to be vaccinated. About vaccines out there, and if anyone doesn't know facts about the vaccines we are giving, the social media is not the best place to get facts about health. You want to know facts about health? Please visit the health facilities and ask those concerned. And thank you. That was all I have for you. 400,000 children, 427,470 if I did not forget. That's the target population of children we are vaccinating. And 27,000. Yeah. I know this offhand there. Am I fatter? 427,000. Yep. Are the target. Are children that we are aiming to vaccinate. And in vaccinating, even the last round, it's the same number of children. It's the same target, yeah. So in coming to vaccinate those kids, like I said, we move from house to house. But it's not just by moving from house to house. We have data collection tools. We have data collection tools for these teams. We have data collection tool for the different level supervisors who will report from one level to another at the end of the day for the 4 days period during the campaign. And through that, we also had here at the central level a dashboard that capture all this information and monitor. And on top of that, we also have a checklist that is developed, an app that is used. We use the ODK. So in you are supervising, you got to use your phone to supervise. It's also captured at the central level to do analysis at the end of the day. So this is how we get, and every other community, because we had health facilities that work within catchment areas. And in those catchment areas are communities. And in those communities are children that are under 5 and their targets are known. So this is how we gather the data. And in the instance that probably we don't have any, we cannot lay hands on the accurate data, we use GBOS, the Bureau of Statistics. So they're also very helpful in giving us the target that we needed. So I guess that is very realistic in the way we gather data, and that's how we are also going to do the same way for this round too. Hope I answered your question. The only best way and the most cost-effective intervention is vaccination. And even when COVID came, it was a pandemic. It wasn't only affecting the Gambia. Maybe for this outbreak, it's only within the sub-region here, the West African sub-region. But then when COVID came, that was an international disease, like a pandemic across the entire world. Were they looking for drugs or lab samples here and there? No, all they were doing was to hasten and provide the vaccines for people to be prevented. So vaccinations, of course, it may be expensive, like you said. Yes, to the Minister of Health, to the donors, vaccines are very expensive. But when it comes to the recipient, the target population we are aiming to give the vaccines across the country is free of charge. All you need to do is get to the right place where you have the vaccines and you got vaccinated without a dime. Just take your clinic card and you are giving us your due doses. And it's the most cost-effective public health intervention ever. And it is through vaccination that smallpox was eradicated on the surface of this earth in 1979. So vaccines are the best way out when containing outbreaks.